Good afternoon, all, and a warm welcome for today's session. Let us start today's session.
Good afternoon, ma'am.
Yeah, this is Dr. Priya. I hope I'm audible to everyone.
Yes, ma'am.
Yeah. So this is Dr. Priya Patki, Organizing Secretary of Webinar-Dematology Society. So today our President Shivanand Patil, due to some urgent work, is not able to present today. So I will be conducting today's session. As you all know, Webinar-Dematology has started webinar series and we invite eminent speakers and seek their guidance. We are fortunate that today we have Dr. Shrikant Babu Perugu sir, who has done enormous work in the field of Ayurveda. He is a fabulous teacher and I had an opportunity to seek his guidance in international conference where I had presented one paper. I know that we all are eager to listen to Sir. But before that, as our regular ritual, we would pray to Lord Dhanvantari. And I would request Dr. Ruchira to come forward for Dhanvantari Savan. Dr. Ruchira.
Yes, ma'am. Namami Dhanvantari Adideva Surasurai Vandit Pada Padmam Lokai Jararu Bhayamratyunasham Datarmisham Vividaushadhinam Shankham Chakram Jalaukam Dadadamritagatam Charudurvishchaturbihi Sukshma Swachhatiritya Shukaparivilasan Maulimam Bhojanitram Ujvalangam Katitatavilasacharupitambaratyam Vande Dhanvantarintam Nikhila Gadavanam Praudadavadnilinam Nikhila Gadavanam Praudadavadnilinam Praudadavadnilinam.
Thank you, Dr. Ruchira, ma'am. Now I request Dr. Mahesh Kachewar, sir, the Treasurer of Webinar-Dematology Society, to please let us know about aims and objects of Dermatology Society.
Am I audible?
Dr. Mahesh, sir. Yes, sir. Yes, sir.
Yeah. Thank you. I am Dr. Mahesh Kachewar, Treasurer of Webinar-Dematology Society. Webinar-Dematology Society is growing by leaps and bounds since last 1.5 years under guidance of our President, Dr. Shivanand Patil. Webinar-Dematology Society is continuously organizing several activities for members of Dermatology Society. We are conducting webinars. Here we are inviting renowned guests who worked in the skin and hair department. We conduct essay competitions for UG and PG students to develop research-based approach in dermatology. We celebrate Women's Day with Her Hunar competition. Dermatology Society conducted health, hair and glowing skin competition. In future, we will conducting innovative events like National Seminar cum Workshop, hands-on training sessions for Dermatology Society members, Dermatology e-magazines, award functions to honor the research-based skin and hair practitioners. Our motto is to learn together and grow together in the field of dermatology and cosmetology. So to join our endless journey of knowledge, we request you to join our Webinar-Dematology Society. For joining, one must be a BMS graduate with some course regarding dermatology or cosmetology. After BMS, if you have completed any course related to dermatology, trichology, and cosmetology, you are eligible for the course. If you are an NIMA member, the fees is 5,000. If you are non-NIMA member, fees is 7,000. Okay. Over to Dr. Patki, madam.
Thank you, Dr. Mahesh, sir. And now I will be giving a brief introduction to the sir, Perugu sir. Actually, we've been wanting to listen to him since very long, and I'm very sure that you will be happy to listen to him. I firstly welcome you, Dr. Srikanth Babu Perugu sir. So I will be sharing some of the highlights of our guest, his inspiring work and achievements. So let us take a moment to appreciate the journey and accomplishment of our esteemed guest speaker, Dr. Srikanth Babu Perugu sir. He is proved clinician, researcher, and an able academician. Treated more than 3.5 lakh patients in 30 years of his clinical practice. Authored books and published many research papers in peer-reviewed journals. He headed the first of its kind, fully funded integrated research project in Telangana on mucormycosis, black fungus, helped Ayurveda enter ICU of Gandhi Hospital to treat severe to very severe cases of mucormycosis. Sir, we are really very proud of you for this work. He has conducted, he has contributed to edit Indriya Sthana of Charak Samhita, new edition project. Trained hundreds of doctors on developing clinical skills, conferred with many awards and rewards like Ayurgenika, Ayurveda Icon, Vishwaguru World Records, Outstanding Doctor Award, a Best Teacher Award, and a Dhanvantari Awards for several times. Best Employee Award by Department of Ayush, Telangana State. His innovations are modified Vardhaman Prayogas are brought into OPD practice. Tailadroni principle is used now to treat many challenging clinical conditions. He is Senate member of KNR University of Health Sciences. He is now Executive Council member of KNR University of Health Sciences. Former PG BOS chairman and president member PG BOS in KNR University of Health Sciences and RG University of Health Sciences. PG BOS member Kai Chikitsa BHU Varanasi. Guided many PG scholars, pre-PhD committee members, RG University of Health Sciences. Attended as invited guest to mark Ayurveda Day celebrations at British Parliament and European Parliament. Delivered talks in many countries like USA, UK, Europe, Australia, Thailand, Indonesia, Nepal, etc. on topic the potentials of Ayurveda in clinical practices. I really congratulate you, sir, that you are taking Ayurveda globally, and we are very eager to listen to you, sir. So please guide us with today's lecture. Over to you, sir. Dr. Srikanth Babu, sir. Hello.
Yeah.
Yeah.
Namaste. Namaste, all of you. Am I audible, Dr.
Yes,
Priya?
yes, yes. You're very much audible.
Thank you. I'm good able to see you, Priyaji, after a long time. And my special wishes to Dr. Patilji.
Yeah.
So all the participants here, namaste, everybody. Actually, this is working hour. Usually, we don't take up the sessions during this as it is a special occasion. It has been long negotiation. We could be planning since quite a long time, but today is a good good time for us to
Thank
meet.
you so much for taking out time for us, sir, from your busy schedules.
Absolutely. You are all sparing time. I equally respect that. So I'll be just talking on a focused topic on trichology and Ayurveda. Trichology, again, you know that it is a very bigger area, but I'm not going to focus on entire trichology also. I'll be focusing much more on hair fall, how to understand hair fall from Ayurveda, and how to diagnose, how to understand, and how to go with the clinical perspectives, and what are the basic elements for the treatment like that. This presentation will go. It will be another journey for 60 minutes. I request all of you to be in touch with this. I try to give you the best as much as possible from my side. And I request all of the doctors, this is a first presentation. I'm doing it for integrative areas. You are all experts in dermatology, but still I'll be talking about very, very fundamental points in the primitive presentation. Please don't mind that I'm talking about the very tiny points, but they are all important when we are applying the principles to the clinical entities. So kindly, and that too, I need to give the Ayurvedic basics and allopathy basics for understanding the integrative approach in diagnosis and practice. So kindly bear with me, and if something is repetition for you, it may be useful for other counterpart actually. So let me start my presentation. Shall I share the presentation, Amma?
Yes, sir. Yes, sir. Yeah, it's visible, sir.
Is it visible?
Yeah, it's visible.
So I'm presently working as director for Department of Ayush, Telangana. It is first of its kind of appointment for an Ayurvedic doctor to hold a director post. Usually an IAS persons will be holding this position. And I equally hold PG professor, that is the highest position in the Ayurveda and another area. I'll be HOD, and I'll be taking classes also for my PG scholars in one of the state's best college, Dr. B.R.K.R. Government Ayurveda College, Hyderabad. This is a brief note on me. And as I told you, I'll just proceed with the number of slides will be more. Don't worry, I'll be taking only the allotted time. So as we are all know what is a trichology and how to put it in a precise way is a science related to human hair and scalp. As I told you, it involves about multiple things, starting from Prakriti to Vikruti. Ayurveda fundamentally believes in understanding the basic health, then disease. Like a modern science look into physiology and then pathology and disease, like that. So these are all mirror images only. I'll be just going with this area. So why this topic is gaining this much of importance is it has good scope for trading, and it involves a lot of commerce, as I'm showing on the areas like hair oils, shampoos, dyes, dryers, and popular and very important area. But I would like to draw your attention on these three: cosmetic, aesthetic, and medical aspects. I'll be trying to cover all these three segments whenever it is possible. I'll be focusing more towards medical only. So I just quickly remind you about skin and its relation with the trichology. So I'll just remind you, it is an biggest endocrinal organ. It helps for growth factors. You know about vitamin D, how skin works for vitamin D metabolism, and it even prevents the osteoarthritis. Contributes for the immunity and other things. You know about that, and skin role, and you know how skin contributes the cytokines and involves to the multiple segments of health internally, though being it is outer layer. So very keywords I'll just quickly introduce and then go with the clinical part of the presentation. You know, the skin is classified into skin is classified into two, basing on the skin, like glabrous and non-glabrous. Glabrous is where skin is covered by the hair, and where there is no skin, we call it as non-glabrous. And these are the three phases: anagen, telogen, and catagen. Three phases. Three types of hair: lanugo hair, vellus hair, and terminal hair. These are very primitive points, but I'm quickly reminding you to go through my presentation. And hair cycle, this is very, very important when we are talking about trichology and hair fall. Hair grows in repetitive cycles and not constantly. It goes into a repetitive cycles. This is very, very important, in fact. So I'll just quickly draw your attention towards hair follicle and anatomy. Medulla, I'll be just, this is a color-coded presentation. Wherever you see the red, I'll be focusing on that area, and rest all other, I'll not pay much attention. Medulla begins at some distance from the tip and ends near the bulb. That's the reason if we go for a haircut, barbers are leaving. This is because it is not covered. So when you go for a hair trimming, haircut, so hair becomes more vibrant, and it will help you to understand the good look and other appearances of the hair. Hair follicle may, in fetal life, produce lanugo hair, and in their coming part of the life, it may transform into a terminal hair. So don't ignore the lanugo hair. So this is a basic thing I would like to remind you. I don't give all the anatomical areas. I'll just give you one important point here, erector muscle. So we know that it is placed in 35 degrees angle related to the hair follicle, where it facilitates cutis anserina mechanism, which is popularly known as haripulation. So just imagine if this particular muscle is not placed at this angle, humans might have suffered a lot because of the skin health. We see sebum, if it is not coming, you see conditions like psoriasis, where patients will suffer a lot by dryness, xerodermas like conditions. So this placement is very, very important. I'll be just telling you how these things are happening from Ayurvedic perspective, why it is being placed like that. So the Ayurvedic terminology I would like to introduce for all of you. Kesha is commonly used term, but it is understood as astimala. Asti is one of the saptadhatu, and smasru is sukramala. These are saptadhatus: rasa, rakta, mamsa, medha, asti, majja, and sukra. These are seven. These seven are Ayurvedic fundamental structural elements. Vata, pitta, kapha are functional elements. So with the permutations and combinations of these three only, we see a lot of diseased conditions, and we convert entire pathology into this, and then we choose reverting that or treating that. So Kesha is a astimala, that means calcium metabolism and bone formation and all other things, how they are contributing for the physiology and pathology of the hair. And secondary, Sukra is a hormonal and immunity area. So how this is helping for the secondary hair? So these are the terms. Nasa Kesha, the hair appearing in the nasal cavity, and Pakshma, Kesha in Karna, Roma Sanjanana, Patana, and Shatana. Why I am using this? There are n number of terms. I'm not going with everything. So salient features I am bringing to your notice here. Ancient science like Ayurveda, see, thousands of years back, they could able to mention many important and core elements of trichology in those days. Hair fall and hair regeneration, hair coloring, and hair, its course of distribution and its anomalies. So all those things were being mentioned thousands of years back in Ayurveda. That was my interest in working on trichology since 3 decades. So it is a Pitruja Bhava. In Ayurveda, we believe that it is a paternal contribution is more towards the Kesha. And distribution of Kesha is Swabhavaja. So there are 6 factors which can influence the human body, like color, why pupil is to answer such questions. Swabhavaja, there are certain things are determined by the nature, certain are inherent and coherent. So this is inherent actually. So Roma Kupas, they are contributing for Svedavaha Sroto Mula. That means it is involving into the sweat mechanism, and it supports in thermal regulation and body pathological distributions also. It will be contributing. So that is the reason why we are telling it is, because disease roots are being classified into 3: Bahiparimarjana, Antaparimarjana, and Tiryak. So this contributes for Tiryak Roga Marga. Then these are the core Ayurvedic elements. I don't know how this can be, if I start explaining, it takes a lot of time. So I'm just touching on this and I'll move further. I told you about Saptadhatus, and this has been, trichology. Hair-related complaints are being narrated as Rasa Pradoshaja Vikaras and Asti Pradoshaja Vikaras, calcium metabolism and nutritional areas. They're significantly mentioned. Of course, immunological also are mentioned at some other points. I'll be touching them in the coming part of my presentation. And Ayurveda speaks about 8 despicable persons which are called as Ashta Nindita Purushas. These 8 are a little different and difficult to treat conditions. Among one set, aloma, atiloma, they where hair is present, or where there is absence of the hair or displacement of the hair. So either way, they'll be coming into this segment. So for example, I'm just quoting you 2 segments here. Hair is not normally present here, and hair which are to be normally present here is absent. So this is been called as Swabhavaja. So if it takes a course deviation, so then congenital anomalies or diseased conditions, all those things will come. So aloma and athiloma, 2 examples. I'm just quoting you by a pictorial representation so that we can easily identify. So another few terminologies I would like to quickly mention and move further. Kesha, there are a lot of minute descriptions. We need to understand this so that we can rightly diagnose and rightly pick up the drug. Kesha speaks about scalp hair fall. Kesha is a scalp hair present on the hair, scalp. Roma is a body hair, and smashru is a secondary hair, preferably on beard and secondary. All secondary hair are considered as smashru. And loma is a lanugo hair. See how beautifully they have given the nomenclature for even hair present at different areas, hair present at different stages. All those things are being named properly. Roma Shatana and Roma Sanjarana, I have mentioned earlier. So a few more terminologies which we deal in this presentation are pidikas. Pidikas are pustules like appearances. Palitya, that means discoloration, depigmentations. So Khalithia is a diagnosis we commonly use for scalp hair fall. Of course, few conditions permit to call scalp hair fall also as Indralupta. But after critical evaluation of the literature, we have made some restrictions and limitations in using the terminologies. Khalithia represents scalp hair fall. Irivelaka, painful pustules. I'll be showing the pictures so that we can understand more, because the terminology conflicts will not be there in that. So, as I told you about the clinical conditions, Indralupta, hair fall from beard is to be called, but in 1 or 2 books they have mentioned even scalp hair fall can be called as Indralupta. But if you use drugs and drug clinical efficacy and other things, it is good to name Indralupta for beard hair loss. I'll be talking to alopecia areata-like conditions. Ruhya is a condition where body hair will fall. And Dharunaka, dandruff, what we commonly call. Arumshika or pustules or folliculitis or furunculosis, like that. So all those conditions comes into Arumshika. Very, very difficult actually. We have developed a simple protocol. Without any antibiotics, we are dealing this group of cases since decades actually. I'll be sharing that formulation also. Roma Vidvamsi, there are mentioning of the krimis. I mean, worms or bacteria or these things. So Roma Vidvamsi, Roma Vidvamsi, Roma Harsha like conditions. Roma Harsha, usually we use a term called horripilation, where Jaladhar impuantum, and the body will move like this, no? Horripilation. The technical term for that is cutis anserina, and lice and other things, their presence are also being mentioned as diseases. So human hair, don't think that this is only for combing or say replacement or something. In Ayurveda, it has a lot of significance. It is contributing for one of the diagnostic area, and it helps us to understand the magnitude of etiopathogenesis, which is popularly known as samprapti. One is it contributes for etiopathogenesis. Second, it helps to understand us to know the disease magnitude, and it helps us to know the prognostic scoring of the disease. And we can even understand the involvement of dosha. The Samshamsha Kalpana is a very critical point in Samprapti. We call it as very, very important aspect. That also can be understood by having a clear look for a minute on your hair follicle. This also, hair is also helpful for certain chikitsas, and it gives us warning signals where to be more alert, where not to be, like that. And even it helps from Ayurvedic science when we are performing a medical emesis process, which is popularly known as Vamana Karma. So we always see that we can understand that the doshas, doshas, morbid factors, when they are moving from the body from one place to one place, we can understand how they are moving inside by knowing the hair behavior. So these are all the contributing factors. As I told you about USS development from the forensic aspect, they have documented the water and regular components of the areas in certain states. And if you stay in that state for 2 months, then your hair follicle will tell you whether you are there or you are not there. So this is a simple research aspect I would like to share. I'm not focusing much. So there are some differences. Say if you see the modern science, you see the numbers, great significant differences being observed here. 1 lakh follicles on scalp, 1 million follicles on face, 5 million follicles on total body. See the significantly high scoring numbers. Whereas Ayurveda, one second. Yeah. Ayurveda deals about, it mentions that Roma Kupas are only 30,956. Drusti Roma Kupani Navardhante Kadachana. They are been mentioned, and you cannot even minimize, they will not grow after some time. So that after birth. So the striking difference we need to understand, and I don't find much reasons. I'll show you where I have collected one slide where from one follicle that more number of tufts will come. So such conditions might have existed earlier. I don't know, not to simply support, but that is one area where I have seen such slide. I'll be sharing it in that, but there's a striking difference between these numbers. Yeah, the hair care. Sadhyojata upachara or balaka upachara. The baby, soon after the baby birth, they place a loaf of cotton dipped into ghee on the forehead. This helps for the reunification of the internal bones, and this also helps to preserve the hairline and health. So Ayurveda recommends hair trimming once in 5 days. As I told you, medulla is not covered in the tip. So once you start making them open, so hair breathes properly and hair stays healthy for a longer time. No abuse of hair. Keshagrani na dushyante. So after bath, we abuse the hair like this. We use towels, squeeze them. So like that, excuse me. So no abuse of hair. And hair should be veined or combed properly. Hair combing and other techniques are also very well narrated, because this helps static electricity to flow on the scalp, and this keeps the hair more bouncing, more circulated, and more vibrant actually. And if we don't do this very often, we go by this. Sakesha bhumis putana. The scalp will get dry and they get furs also, cracks. So these are all simple intrauterine life areas. I don't find that this is very important for this clinical presentation. For research presentations we use. These are the important areas. Ayurveda contributes us extra knowledge from hair, that the hairline present on the abdomen and its complexity towards right or complexity towards left. This determines whether the baby lying in the pregnant womb, whether it is male or female, and whether single fetus is there or two fetus more than single. I don't say two only. More than single is present in the womb. That also can be identified by the presence and the structure, specific appearance of the hair on the abdomen. And we have two important points which may take time to explain. Like if a woman undergoing for a menstrual cycle and she combs her hair very often, in that cycle, if she conceives, then the baby gets fragility for hair fall. So this is one area. And the last point may not be, it takes a lot of time to explain. I will not go with that. Anagen. So as I told you about 3 phases, I'll just quickly go with that. This is a growing phase, and everybody, we all wish to keep this for a longer duration so that hair stays stable. These are electronic pictures of electron microscopes, which are actually collected from rare books, in fact, with their permissions. Anagen, and this is the telogen. This is a resting phase where you are seeing this is a resting phase. It ceases the growth actually, then the whole hair follicle starts growing with a new hair that pushes this, and it will be replaced by a new hair. So this is the transition. See, transitional phase. This will be a new hair follicle. So once it comes, once it grows, automatically the follicle will be replaced. So I told you about Lanugo's hair. It is fine hair, lightly pigmented, covers most of the whole skin. Exceptions are these areas, dense on face, limbs, and trunk. So replaced by vellus hair by first month of life. So you can see a clinical where you can clearly see how this particular Lanugo hair appears in a close look. I think you can appreciate this. Yeah, this is a vellus hair. Usually covers the female skin. Though I try to click good pictures, they are not visible here because of the resolution issues. You can see these are all the vellus hair. So Lanugo hair turns into this area, you might be knowing, but still I would like to give the terminal hair, where coarse, thick, pigmented hair, and formed into a terminal hair, and everybody loves to have this phase of hair. So this is our motive while we are treating. So hair helps us in many things. Like I told you about Prakriti, the genomics. If you want to understand the internal configuration of a individual, either physical or psychological triads, so hair becomes as a tool to estimate the genomics tool, Prakriti. So Ati Ruksha Kesha, Ati Ruksha is very dry, Ati Ruksha Kesha. This Ati Ruksha Kesha and Smasru, the hair and secondary hair, if it is very dry and very sharp, very coarse, then it is contributing for Vata Prakriti. Whereas Vali, Palita, Kalitya, so easily falling and easily discoloration and wrinkles are there, oily hair is very oily, then it helps us to understand the Pitta Prakriti. Sthira, strong, Kutila, very intact, Alinila or Atinila. There is two conflicts on this. Alinila is a different color. Atinila is a different color. Atinila is a bluish black. Alinila is jumbo-like color. So this contributes for Kapha Prakriti, and this may not be needed here. So I'll just show you high resolution pictures here, where if you know about Vata Prakriti, this type of hair and different phases of this can be contributed for Vata Prakriti. I don't have much of see, this is Palitya. Palitya, Kalitya. This is a Kalitya. So coming from Pitta dominant. So I kept a primate picture to give a Palitya look here. And this is one of the most cherished picture. Sthira, Kutila, Alinila, Kesha. So you can see long, strong, and very colorful and very curly. So these are all contributions of Kapha Prakriti. A person who has Kapha Prakriti, by inherent features, they grow this type of hair. And here we require the simple medications only. We don't go for a very high potency medications. For that, it will be helpful. I quickly scroll down with male pattern baldness pictures. You are seeing different stages of that at different ages. And now male pattern baldness also been described in the modern textbooks. So these are all the arts, and these are the pictures how they look on vertex photography, in fact. So vertex photography helping to understand the male part. Picture shows about different parts of cycles in one simple picture. So hair does not continue to grow indefinitely. It grows in sequence. So only to emphasize this point, I brought this here. So how we need to understand the etiological factor? I'll just quickly go through this. So any infection of the scalp or surrounding areas, any infection of the scalp directly or in the surrounding areas like sinusitis, tonsillitis, so focal infections like dental caries, any infection can increase the hair fall. And dental, I told you about stress, nervous tensions, all those things contribute for the hair fall. And hair has a synchrony with the seasons. So we understand the seasons by two names, Visarga and Adana. So in one season, we'll have more strength. In one season, we'll have less strength. So 3 seasons fit into Visarga, 3 seasons fit into Adana. Like Hemanta and Shishira Rutu. I'll just show you in the coming part, next slide, how it can be understood from modern calendar, Gregorian calendar. Hemanta and Shishira Rutu causes rasa dushti, I mean nutritional deficiency, and increases the dryness in the body. Hence, ghee-like preparations will help to minimize the hair fall. A natural physiological hair fall can be minimized by this type. And in Sharad Rutu, as it inherently increases the pitta dosha and leads to it also increases the anger and krodha. So that leads to palitya, discoloration. So if you do mrudu rechana here and nasya with kshirabala-like areas, this can be prevented. So this is a seasonal preventive protocols actually. So this is a slide which is self-explanatory. Sisira, Vasanta, Grishma, Varsha, Sarath, Hemanta are the sequence. So Sanskrit masas, Magha, Falguna, Chaitra, Vaishaka, Jyeshta, Ashada, like this, and modern months. This is not uniform and everybody accepted, but more or less it can be understood in a near dates. January 22nd to March 21st, it contributes for Adana Kala and Sishira Rutu. These 2 seasons, where I am showing you in red color, Adana Anta, Visarga Adi. So these 2 seasons are very vulnerable for the diseases, all the diseases, not only hair and skin. So we should be more cautious during this season because disease spreads virulently and patients' immunity and strength will be less. So we need supplements, nutritional supplements also to be used more during these months only. And here that is not much needed. So I would like to quickly remind you about the importance of Nidra. Nidra yattam sukham dukkham pushtikasya balabalam vrishata klibata gnanam agnanam jivitam nacha. So these are duels which are being given by, if you go for good quality of sleep, all the top ones will come. A good quality of sleep increases sukha, that means comfort. Pushti, good nutrition. Bala contributes for immunity. Vrishata, it balances the endocrinal system. Gnanam, it contributes for integrity and cognitive functions. And Jivitam, it helps for the longevity. If you are not using Nidra, I mean sleep, as a proper tool, that it inverses the conditions. Like Dukkha, it causes to the discomfort. It emaciates you, it will not nourish you properly, it will improve, it will hamper the immunity, it will interfere into the infertilities and hormonal issues, it will make you confusive and your performances will not be proper and you will be going down in that. And it may also contribute for the fatality of the life. So Nidra, so sleep. So this is also important. And common etiological factors, as you know, about malnutrition, hormonal, metabolic, drug-induced, hypervitaminose, genetic, etc. Ayurveda also speaks about krimi, ama, atapa sevana, and ushna, ahara sevana. So this is etiopathological diagrammatic representation by flow charts. Vata and Pitta, they reach Romakupa by inherence, and there they mitigate into the integrity of the hair follicle. So it allows hair to lose, hair to fall. So Kapha and Rakta causes Sangha there. So they'll not be causing any regeneration there. So we have different line of managements at this level, different levels of management at this level, and different levels of management in coming part of this. Say, so Kesha, so this is another area where Khalitya and Palitya, they may fall and discoloration. So for this, a different group of drugs, for this, a different group of drugs, different protocols to be adapted. So coming to the core point of the presentation, to understand the differential diagnosis, which are very commonly mentioned, there are huge number of alopecias. I'll just classify them into required treatment. I mean, alopecias which require treatment, alopecias which don't require any chemical treatments. So this is traction alopecia, pressure alopecia. They don't require any treatments. You know, androgenic alopecia, it require management. Trichotillomania, though it is not related to direct trichology, but hair related, and it is a psychiatric problem where we can treat it very comfortably. Drug-induced also goes into toxic levels, but this also can be dealt by us only. And autoimmunity areas, we have developed some new protocols for this. I'll deal them in the coming part of the present. The quick pictures, you know, the school going girls, and they usually children wake late, and school buses will be always early and school hours will be very early. So they'll be running. And so when you want to wean the hair, the quick and pressures tractions will be more. So that leads here. So if you reduce that, time management and gentle handling will remove this. And pressure area, if baby is left on the cradle for a longer duration without attending, these are the pressure alopecias. You need to change. So that is only the line of management, and you don't require any medications. And this is a clinical challenge actually. Endocrinal alopecias, where we are finding difficulty. Genetic areas also, in certain areas, we are not finding any sort of improvement. And these are good areas for our clinical practices. Andrographic, androgenic alopecias, they take them, and I'll show you the drugs which are helpful in these conditions. And this is what I was telling you. Alopecia areata, secondary hair, you can see primary hair. So the line of management will be similar, but internal medications and internal supplements will differ for this both actually. And male and female also, basing on the skin type and hair type, we require to choose the oils and other things into a different configurative mechanisms. So I told you about Arumshika, where gapless pustules will be there. The oozing will be there here. The one can be identified as Iribellica and one is identified as Arumshika. The problem with this is you apply any ointment, you cannot clean. If you apply any medication, you cannot clean and maintain hygiene. So secondary infections will be more, in fact. Here also will be like that. So we have developed simple Triphala Gugulu 1 to 1.5 gram per day after food, and Panchavalkala Jala or Triphala Jala. That means Triphala soaked into overnight. We'll prepare Himakalpa and decanted very well. And we just wash through that and dry it, so that it helps for the self-healing and it will not allow any further infection to precipitate. We are not using any antibiotics in this, and we treat only by Ayurvedic configurations, even in such infective areas. I told you about 30,956 follicles might be calculated like this. I'll show you. In one follicle, you can see how many tufts are coming. So anthropological study and observations, if you look, I have not done that. So we may find that earlier ancient days, perhaps these type of follicles might be more. That is the reason why they have mentioned 30,956 instead of striking different numbers from the modern science. This is only a small understanding. I don't claim anything on that. So trichotillomania, you know about name itself speaks about it is a mania. They pick up hair, keep it in the mouth, and Ayurveda narrates about this particular condition in Sannipata Javudara. They describe that tufts of hair follicle presence, its presence in the intestines, and how it should be operated and how it should be cleared from the intestines. They have described in the surgical aspect also. So trichotillomania, tricho related to hair, tillo plucking, mania eating. So this requires Mahakalyanaka Grutam, Manasamitra Adivati, Mahaparisachika Grutam like drugs. So automatically their inherent nature, inherent practices of picking and eating will come down, and it requires some Sattva Jaya Chikitsas also. So women are exempted. As per Ayurveda, women are exempted from hair falls because of Atyanta Shukumara Anga, Rajo Darshana, Avyayamata. But now women's lifestyles begin resembles to that of men. So they are not exempted for hair fall now. So now we are seeing hair. Actually, this itself is a very huge topic, but I'll just mention one thing. Complexity of their actions. Hormones profoundly influence hair growth. This has been unraveled. Actually, this topic itself will be 1.5 hour presentation. So duration of telogen, duration of anagen, and intrinsic rhythms and their role with the hormones. This is very, very complex mechanism. But one particular statement I would like to bring before you: hormones have a profound role to play in hair growth. So likewise, hair growth into abnormal areas also. Hair where that is normally absent, if hair grows there, that will be an inverse rhythm actually. So I'll be mentioning one particular point called hirsutism. So actually we have produced one dissertation work on this, and this is also working very good in hirsutism cases. We have used all international standards and we have published one case study. We get often inquiries on this, and my postgraduate scholars still they handle this group of cases actually. So this is called inverse rhythm. So normal numbers I'll just quickly mention, and then we'll go for the treatment parts, diagnostic and treatment perspectives. Male vertex hair grow 0.44 mm per day, whereas on temple area 0.39 mm, it is little less. Beard, it is little more less 0.27. So female skin grows 0.45 mm. It is more than what you are seeing on male vertex. So this is, you need to understand why women possess a long hair, why we treat female. More successful cases will come there, and quick responses you will see because of all these physiological factors. And you know about the density of the hair for the researchers. So you have simple instruments, just take a picture and put it into a area. It counts the follicles and gives us information. So in cubic centimeters, cubic column of centimeters, 615 cubic centimeters, 615 follicles at the age of 20 to 30 is normal. If it is less than 309, it is called bald, and this will be seen as a physiological in 80 to 90 areas. And hairy, very hairy means 459 follicles per centimeter square. So these are the research, information which helps us to formulate or to design a research on this. So clinical approach. From here, all these previous points will help us here quickly to understand and wrap up the presentation. Proper clinical history is a very important factor in understanding the trichology. Actually, you need to understand all the factors, whether it is a Pitruja, Bhava. So when patient comes with a male pattern baldness, you need to know about the paternal history and their baldness, their All those histories we need to understand properly. And obesity, if it's running in the family, then you need to understand that. Diabetes, you need to understand. So like that, properly, you need to take the clinical history, routine blood investigation to understand physiological and abnormal areas, lipid profile to see, to attend any other assistance, hormonal assays, renal profiles to check the toxicities, hepatic profiles also, liver LFTs are also important. Height, weight, and temperature and SpO2s also help us to understand the total health levels of an individual. This forms the basic strength for the clinical practice of dermatology or trichology, what I personally believe. So these are the few tools what we use for trichology. Vertex photography, I'll be showing the pictures in the coming part of the slides. Hair pull test, light microscopy of hair, electron microscopy of hair, polarized light microscopy, but these are little expensive now. So you can use your cell phone, mobile phone with a specific lens available in the market. You can fix them and take a picture so that you get good quality of pictures to analyze the scalp health and hair health also. So this is our text photography, a proper normal classical DSLR camera fixed to the stand, and hair scalp is kept in 30 to 40 degrees axis so that you can take a picture. It helps for the research and it helps for the study and it helps for the case understanding also. So hair pull test, actually this has been there in the textual literature since quite long time, but Vatika hair oil prepared by the Dabur, as they have advertised this in the front lines of the newspaper, this became as a very popular test for trichology. But we should be very careful when we are catch holding of the hair follicles and pulling. It should not be like this with a heavy strength. So it should be light and gentle so that whatever follicles comes, you can see whether the follicle twig is coming, total follicle is coming, then you can understand the follicle is weak or hair is weak or fragmented hair, so that you can you can choose a right drug for that. And this is one of the polarized light microscopy picture of the hair. You can see it is a tiger-tailed pattern. If you just see normally, you feel that this is a tiger tail photo like that. It's only a resemblance. It has nothing to do with that. So this is light microscopy of hair. You can see only medullary part of that and covered by the areas. So this is a electron micrograph of the hair, where cylindrical structure you are seeing here. If you use hard surfaces for resting the head during the night or during office hours, that tends to damage the hair here in the joint. Cylindrical part becomes ribbon-like and it helps. You can see it becomes thin here. It becomes ribbon-like, it becomes thin here and hair gets broken. So this to be avoided by hard surfaces hitting to the head in resting phases or working phases. So these are the photographs which I have seen. Coming to the treatments. I'll be taking another 10 minutes. 10 to, yeah.
Yes, sir. Continue, sir.
Yeah. Kindly permit me. Thank you. Thank you.
You can
So
continue, sir.
treatments are of two types, preventive and curative. So under preventive care, we take much of role about ahara, the diets and dietetics, vihara, activities, do's and don'ts. So how much activity a person should do, how much rest he require, all those things will come in preventive, and few points I have covered in the previous part of the presentation. Curative, we go for bio-cleansing, which are popularly known as panchakarmas. Not all panchakarmas are required for everybody. So we assess the case when dosha prabalyata is there and patient tolerance is also there, then only we prescribe shodhanas. Major shodhanas. Otherwise, we can go by simple OP level managements also that comes under Shamana, palliative line of treatments. So Ayurveda speaks about multiple classifications of the treatments. I present here the simple presentation called Langhana Brahmana. That means two pairs. These treatment consists of three pairs: Snehana and Rukshana, Svedana and Stambhana. So we need to choose which two or which one to be applied on the patient. If patient is obese, we go for Langhana. Patient is malnourished, then we go for Brahmana. Patient's body is very dry and his sleep hours are very less. Night he is working and his nutritional levels are also poor, then we go for Snehana. And if he's not, is over obese and he is taking much of no activity, then we go for Rukshana. So opposite like. Svedana and Stambhana. The body hair also is very, very sticky, lifeless, then we go for Svedana. And if it is very oily and very weight and it is not, it is falling very quickly, then we go for Stambhana Chikitsas. I mean, hair, we will increase the strength and potency of the hair follicle. Another treatment classification is Chikitsa can be classified into Swastasya, Urjakara, Urjaskara, Aturasya, Roganut. Swastasya, Urjaskara is for a normal healthy being, how we can prevent. We use principles of Vrishya and Rasayanas here. The principles, I am not telling the drugs. So Ashwagandha, Kapikatsu, Shetavari, they are used for this. No, that's not my idea. The principles laid down for Vrishya Chikitsa and Rasayana Chikitsa. Vrishya Chikitsa is a selective target. Rasayana Chikitsa is a consecutive targets. I mean, transformatory nutrition, selective nutritive areas. So where Vrishya Chikitsa even facilitates us to give the nutritional supplements like vitamins, calcium supplements, vitamin D3 like that, where Rasayana will not help us to go in that way. Aturasya Roganut, I mean diseased condition. So we have threefold management here. Yukti Vyapasraya is again considered into Anta Parimarjana, the medications what we give internally, and Bahi Parimarjana, the medicines which we are applying only to the external surface, and Sestra Pranidhana, the modalities which require instruments or any adjuvant material to scrap or to make the skin to bleed or make the skin to scrap or something, Sestra Pranidhana. Daiva Vyapasraya, a spiritual line of management. Sattva Vajayas are counseling and non-medical managements. So these are the gross picture of treatment classification in Ayurveda. And I told you about Panchakarmas, where biocleansing mechanism is now used as a replacement term for this. It is not exactly what biocleansing. The disease morbid factors which are excessively accumulated into the human body, we access them through specific mechanisms. We bring them together to the nearest area and we try to evacuate from the body through a nearest exit. So either it may be, if we are bringing it to the oral cavity, then we call medicated emesis. If we are pushing it down through the rectal cavity, we call it as medical purgation. And if we are doing it to the nostrils, so it is nasya. So if we are making a way out and selectively we are removing the blood and its vitiated components, we call it as rakta mokshana. So like that. So after doing this, paschat karmas will be there, where we try to bring in normalcy and apply the palliative care. And lastly, we use Rasayana Chikitsa, where a selective nutrient and normalizing the mechanism, normalizing the physiology and establishing the physiology is called as Rasayana. So Ayurveda is good in Rasayana Chikitsas actually. So if we start Rasayana Chikitsa at the end of your treatment, patients will be on good note of health for a longer duration. So Murdni Snehas, we use certain treatment modalities on the scalp. We have 4 modalities called Abhyanga, Seka. Abhyanga means application of oil, selective application of oil through much, no pressure will be applied here on the scalp. Seka, the medicated liquids will be allowed to fall on your forehead from a specific 4 inches distance, like this, in this much of distance, with a stream and pressure, temperature and pressure controlled flow will be allowed to fall on your forehead. This is one, and the liquid flows into the scalp like a streamlined way. Pichu is you soak the medication into a cotton area and you place it on the forehead. Forehead again, you need to see, keep the hand like this, close your hands like this. See, this particular part should touch your hairline beginning. Then you keep like this. So this becomes mudni. I mean, actually, head, important area of the head. So if you apply the pichu, I mean, cotton swab dipped into oils or decoctions or medications and keep it on the scalp. This also is one modality. And you keep a cap-like material and pour more of oil, like 1.5 liter oil, and try to stay there for a longer duration. This helps the higher pathogenesis to revert. Yeah, this also actually, okay, I'll just tell one point on this. See, for all Vata Vikaras, we have developed a component called essentially management principles. So for all Vata Vyadis, Vatanulomana is very, very important. So Prana Vata, because we know that Vata is again of 5 types, and Prana Vata is involved with Prana Vata. Then Nasya and Basti will be helpful along with Vatanulomana. VA is common for every segment. Prana Vata involving Udana Vata, Vaman and Vatanulomana, Prana and Samana, Pachan and Vamana and Vatanulomana, Prana and Apana, Virechan, Vasti and Vatanulomana, Prana and Vyana, Vasti and Vatanulomana. So perhaps I cannot explain you to a modern doctor on this, but this is a core element while we are formulating the treatment modalities from Ayurveda. So for all Ayurvedic doctors might have appreciate the importance of this. This is my contribution. Satyojata Upacharas, preventive care. See, I told you about keeping a ghee soaked cotton on the scalp as the first activity for the baby, newly born baby, and growing on regularly growing babies to the elder age. We have nasal administration of the medication, which is called as Nasya, and Anutaila is used. Anutaila is a medicated oil which is processed 100 times through milk of the goat. So this reduces and potentifies the ingredient. So when you drop it into the nostrils, usually for first 10 to 14 days, you don't see much improvement. But after 14th day, you see the strength. Hair fall will come down, hair strength, you can see hair integrity, you can see hair, all the preventive areas. And as I told you, hair should be given time. For trichology, one don't need much money or anything else. He require time to maintain the hair and health. Unfortunately, now social community, all communities, they are lacking time to give for their health and as well to the hair. So naturally, the more potential factor for the practice for all of us. So I told you about na keshagrani abhishanyet. When you take a bath, you do like this. Usually youngsters, they play like this. And this will cause fractures in the hair structure. And consequently, 3rd day, 4th day, when they comb the hair, so hair twigs will be more falling down. So no abuse of hair. Likewise, single drugs which helps for the hair growth are amalaki. It is mentioned as Vayasthapana Dravya, ST and Madhurasa. All sweets helps for the hair growth actually. That is the reason in Ayurveda speaks in pre-diabetic patients, hair fall will be reduced and hair growth will be increased. So like that, if your hair is very damp and lifeless, then Amla Rasa, take Tilitaila, 1 spoon of Tilitaila, not 1 spoon, 10 ml of Tilitail, and then add 1 spoon of lemon to that and apply it to the hair. Leave it for half an hour and take a normal bath. Then your hair will bounce and it becomes lively and it will be stimulated. And cutis anserina mechanism also will be precipitated, and your whole body hair or scalp hair or beard hair look very healthy by this. This is only a simple external measure. And of course, it can be used internally by other medicaments containing amla rasas. Even a cup of lemon juice helps for the hair fall. So the principles are Shodhana, Nasya, Taila, Lepana, and change of profession. So actually, Vritti change, I mean, the change of profession they recommend as a modality for treating the trichology. We have tried, we have seen few evidences, but we don't have much data to share as a scientific tool or scientific evidence for this, but we have few cases, but I cannot share them as very lesser in number. So coming to the end part of my presentation, I'll be showing you a few pictures. ST Madhu, as I told you, this is Glycyrrhiza glabra. And this is Haritaki. This is Bringaraj. And this is Gunja, Abrus precatorius. And this is Haritaki, I told you, in the wet and dry one. And these are till. So 2 types of tills. They're all helpful for treating the hair diseases. Cuscus, it is one of the best drug, helps for the, not this, I'm not recommending, this is opium where it is banned, but cuscus comes out of that. But this is drug helps for the hair fall. And Lasun Kshirpakas we take the loaf of Lasun and we assess the costa of the person. If person is having Mrudu costa, I mean, this is one type of classification of the gut and its digestive abilities, Mrudu costa, then we go by 5 loaves, crush them, put into 100 ml of water, boil it for 10 minutes on a high flame on the stove, then reduce it to the sim, then add 50 ml of milk, stir it on slow, continuously stir it till it becomes 60 ml, decant it, then let it become normal temperature, then add 5 ml of Erenda Thaila, purified castor oil, and give it in the evening time as a single dose for 1 week. So like that, we have stabilized the Lasana Kshirapakas. If time permits, I'll explain in another slide. This is Gokshura, Tribulus terrestris, honey, and this is ivory. Ivory is used actually as a hair regenerative factor. There's a lot of work done on this at Government Ayurvedic College, Mysore, where I did my PhD. And one of my senior did a wonderful work. We lost him very recently, Dr. Lingaya. Very sorry for that. He has done extreme work actually. And Nimba Bijas. I mean, neem seeds, you can take them and this is a Brungraj actually. So you take the juice of this whole plant, this particular plant, Brungraj Ras, and this is a neem seed. You can put it into seed or seed powder. You can add to this and triturate them properly until it becomes dry. Put it for the complete dryness. Second day, again, you do the same mechanism. 3 or 4 days, you do the same mechanism. Keep that powder intact into a bottle without getting exposed to the weather and different seasons. Then take that, add little of alum powder, make it like a paste and apply on the areata, alopecia areata, where I have shown you patches here and here, small patches. There it works very good actually. So, we don't use Vibhitaki, but they very good help. Alum in different combinations for external and internal use also we use. This is available in the market like alum basma, Shubhra basma, or Spatika basma. This is available in the market. Very, very economic drug. For 20 grams, they charge around 20 rupees or so. Very cheap, and it comes for a month actually. So curative care, as it contains about a lot of combinations actually. So Brungaraja Thaila, Natsya with Vibhitaki Thaila, ST Madhu, Amalaki Kalka, and other things for hair growth. You can remember this. ST Madhu plus Amalaki Kalkam, 4 times Tilathaila and 16 times of Kshira. It is a Thaila Pakavidhi. You prepare oil out of it. So this helps for the hair growth. Lice and hair, the lice is a menace of the hair actually. The mothers of teenagers and younger children, will suffer a lot. Parents of younger children, they suffer a lot because of the lice, because when they go to the school, they become like this and they speak. So they come with the lice infected and dandruff infected. So for lice, what we have developed is fine powder of musta added with fine powder of subrabasma in specific combinations. We just make a powder combination, put it into a cloth loosely and just sprinkle like face powder on the scalp. It goes on settles on the scalp. Then slowly comb the hair with hands only. Tie a cotton cloth for 2 or 3 hours. So this powder, I mean Vidanga churna and alum powder, this creates an irritating environment on the scalp for the lice. So they all travel and catch hold of the cloth. So slowly, tactfully, you open the cloth and burn it, so that their eggs also will not be on the bottom. So if you repeat it for 3 or 4 times, the lice severity will come down actually. So Gokshura, Tilapushpa, Hasti Dantamasi, I told you about. Hasti is elephant and Danta is ivory, and it is burnt internally with a specific technique, and that powder is used as hair regenerating mechanism, but it is not allowed because of the Animal Conservation Act now. So we need to see for the alternative. So I told you about a combination I'll be sharing. Sorry, I took more time. I think 1 or 2 slides. Kindly allow me. For inflammatory mechanisms, I told you about folliculitis-like conditions, furunculitis conditions. Chopchini churna 60 grams, Samirapannaga 10 grams, Pravala pisti 10 grams. This is a month course. This can be divided into 90 doses, morning one, afternoon one, and night one after food with honey for 1 month. And this helps to treat folliculitis-like conditions, Arumshika and Iribellica, without any antibiotics. I told you Trifala can be an addition based on the requirement, and Panchavalkala Kvata or Panchavalkala Kashaya or Trifala Kashaya or Trifala Jala or Panchavalkala Kashaya with little addition of Shubhra into that, alum powder into that. So for cleansing mechanism. So that helps a lot. And I told you about we have developed special bastis like Balashwagandha Thaila, 60 ml, Pravala Pisti, 1 gram added to that, make emulsification and quickly taking all precautions, give it in basti format for 7 days in a month. So you can use Balashwagandha Thaila or Mahamash Thaila. On both these areas, we have produced information and data from our department. I told you about Hemakalpas. This is also a new contribution from our department, and we are using this into various other conditions. Of course, this helps for the trichology also. We just take the powder, 25 to 50 grams of powder, soak it into a 500 ml of water in the night, rinse it properly and close it. The next day morning, smash them and ask the patient to consume in the first 2 hours gradually with the pulp. So this helps them to have more added help for the health. So Vardhamana Pippali Yoga, actually, this is a new domain we have developed. I don't find time to explain. This takes at least 8 to 10 minutes on each slide. So I'll not explain this and these 2 slides. Last one, do's and don'ts. We call it as apatya is don'ts, patya is do's. Patya is Pushti Balapradam. You can see the terminologies. Pushti, take care about nutrition. Bala, immunological support. And Swakarma Nivrutti, I told you about profession change. I don't know how this can be justified. In apatyas, daytime sleep or excessive exercise, consuming more of incompatible foods, salt and spices more. If you consume more of sugarcane products, all these things, if you consume more of alcohol and processed foods and other things like dadi, sukti, prayogas, etc., they increases the disease intensity. And whereas if you practice opposite to this, that helps you to have the betterment of the health. So coming to the last part of my slide, I would like to acknowledge entire team of NEMA for providing me and making me a part of our group, and especially to Shivanand Patil ji and Priyanka ji and Dr. Mahesh ji and the Dr. Ruchira, who prayed for this session, and each one of you for your presence, and for my family today, for allowing me yesterday without even attending to anything and I could able to prepare this PowerPoint exclusively for the today's presentation. So I would like to acknowledge my family, each one of you for your presence and patience. Thank you so much.
Thank you very much, sir, for such a great presentation. And I think we would like to hear you more often. And I think 1 hour is little less for,
Yes,
but we would
yes.
really trouble you, and we want to listen you more with more duration. And each and every slide we want. But I think we will take some questions. Is it okay for you?
Yeah,
With the
yeah.
time? Yeah.
Quickly.
So there is one question on the chat box. It says, please repeat alopecia areata treatment again, sir. So I think, can you, yeah,
I'll just tell you.
yeah.
It can be done in many ways. The simple way, Bhringaraja is a plant. You take the juice of that, whole plant juice, clean the plant, properly put it into mixie, and take the juice by decanting it through a cloth. And take the neem seeds, dry seeds, make them powder, mix it with the juice so that not very heavy juice. I mean, 10 ml of juice and 10 grams or 20 grams of powder and 30 ml of juice, like that. So it should become like a paste. And when you go on triturating it, it should become dry. Keep it alive. Keep it aside. Next day, you add another 10 ml of juice, triturate it. Next day, add 10 ml of juice, triturate it, at least 3 days. Keep it in the hot sun. Then you mix it, put it into the mixie, it becomes very soft powder. You can preserve, and that becomes as an external application. Whenever you are giving it to the patient, add little of Subhrabhasma. That means if you are taking 50 grams of powder, add 1 gram of Subhrabhasma, approximately 1 gram, so that it works as antifungal, antibacterial, and antiviral also. It helps, it intensify the potency of the medication when you are applying on the alopecia areata patch, actually. I hope you
Yes,
can
yes.
understand.
Thank you, sir. And one more question from Shakuntala. Treatment for hirsutism.
That is again a big chapter.
So,
Only we have produced one dissertation work,
uh,
quite long time, I think 2013-14, because it involves lot of tools and expensive investigations for doing a study. So most of the postgraduate scholars, they should spend money from their pocket. So that is the reason why we are not encouraging such studies, because ours is a government institute. So we give stipends, sufficient stipends, but we don't ask them to spend for researchers, actually. So hirsutism, I'll give you.
Yes,
When
yes.
I'm going for that, because that's an exclusive topic,
Yes,
actually.
yes. We can have one more lecture on this, sir. Yes. And Takradhara in folliculitis, your experience.
The problem with Takradhara, people, I told you, no, any medication or any Himakalpa or Kashaya Kalpa you use for cleansing, the cleansing is the problem in Arumshika. So all the drug debris will be residued there in the hair. So you cannot often go for the cutting also, because hair in the tips, it will be smooth. When you are coming to the bottom, it's very difficult for them to even maintain. So the best way, what I told you, Himakalpas. Make Fantas or Himakalpas, decant them properly without any powder. Then you just put like a dhara, seka. And so it becomes dry, and normal water you can put so that it will be cleansed.
Please guide us how to approach in male pattern baldness. I think sir has already told about it. Yeah. So, and scanty hair treatment. How to make hair dense. I think sir already has mentioned about this also.
Yeah.
And one more question. Trichup capsule is useful in hair growth. I think it's I don't know what it contains. Trichup capsule.
Trichup is one capsule manufactured by Vasu, but I don't speak about brands in
Yes.
Yeah.
Erenda oil used locally. Do you recommend?
Actually, external users for only Abhyanga purpose we use, not like a hair tonics or hair oil will prevent the disease condition. No, we don't use like that.
Yeah.
To keep the integrity of the scalp and hair in a proper appropriate way, we use Balashwagandha Thaila or Kshirabala Thaila for Abhyangas only.
Mhm.
Yeah.
Thank you very much, sir.
Thank
And
you.
more questions are coming, but I think you can post the questions on our page, and we will definitely post this on. We will pass this on to sir, and we'll get the answers. Now I will call Dr. Rupali Utturwa to just give a vote of thanks to sir. Dr. Rupali, ma'am.
Yes. Thank you, Priya ma'am. On behalf of the Dermatology Society, it is my privilege to propose the vote of thanks for today's insightful webinar on trichology and Ayurveda. First and foremost, I extend my heartfelt gratitude to our esteemed speaker, Dr. Shrikant Babu Perugu, sir. Sir, your in-depth knowledge, clarity of thought, and practical insights into the integration of Ayurveda in trichology have truly enriched our understanding. We are grateful for the time and effort you devoted to sharing your expertise with us. I would also thank you for taking time for us in your busy schedules. Thank you so much, sir. I would also like to thank our organizers and the Dermatology Society team for their meticulous planning and seamless execution of this event. And Dr. Priya ma'am, Dr. Ruchira ma'am, Dr. Mahesh Kachewal sir, the team of webinar committee, I'm thankful to them also. I sincere thank you to all our participants for joining us and making this session interactive and meaningful with your presence and engagement. Lastly, let us take forward the valuable learnings from today's session and apply them in our practice for the benefit of our patients and community. And I must thank you for Shivanand sir for making possible this platform for all of our Vaidyas to come learn and discuss. Thank you once again and wishing everyone continued success and good health. Thank you so much.
Thank you.
Thank you, Dr. Rupali, sir. And we would really want to listen you more often. Thank you. Thanks a lot. The questions are
Thank you.
coming, but I
And
think
convey my special thanks to Patil sir.
yes.
Thanks
He would
for
have
you.
loved to, but maybe some due to some urgent work, he couldn't attend.
I have
Thank
office
you,
work
sir.
actually.
Yeah. Thank you. It was nice to see you, sir. Thank you very much. And I announce this sessions to be closed. Thank you so much. Thanks, everyone. Thank you.